Welcome back to the Conquering Candida video series. We're going to be discussing Chapter 3, How Do You Know You Have Candida? I love this quote at the beginning of the chapter, "Science advances one funeral at a time." This was a quote by the famous German physicist Max Planck. And essentially what he's saying is that medicine advances quite slowly, and sometimes it takes a whole generation of doctors that were set on one particular ideas before science really advances. I hope in this chapter I'm going to help you learn how you may be likely suffering from Candida. On page 33 of the book, I have a very specific questionnaire that has 15 Candida-directed questions. The questions are a combination that have been scientifically validated in the past, but they also reflect my 30 years of diagnosing Candida. The first question, for example, says, have you ever taken oral antibiotics for longer than 2 months to treat conditions or diseases such as acne, Lyme disease, chronic sinusitis, bronchial infections, or urinary infections? And unfortunately, in my practice, I've seen so many patients on these medications for long periods of time thinking that they were harmless. The second question, have you ever taken acid blockers such as Pepcid, proton pump inhibitors such as Nexium or Prilosec for gastric reflux for longer than 2 months? Again, these medications upset the microbiome by making the stomach acid too alkaline and allows the Candida to overgrow. The third question, for women, have you taken any form of hormonal birth control pill for longer than 6 months? And there are a lot of reasons that women take birth control early on. They could have painful menstrual periods, or of course they do want to avoid pregnancy. But again, all of these are very important in making someone predisposed to getting Candida. Now, I get the question all the time from my patients, is there a specific lab test that can diagnose Candida? I know doctors want it really badly. I know patients want it really badly. And unfortunately, the answer is not yet. Blood tests, urine tests, skin tests, and even stool tests are just not accurate enough to make the diagnosis. That is why it's so important to have a doctor that's experienced and knows to ask the right questions, because that essentially is what's going to help make the diagnosis. But don't despair. In the next video, I will be discussing my original diagnostic staging of Candida, which really helps to explain why you're having the different symptoms. If you like this video, please go to our YouTube channel, The Smartest Doctor in the Room, and hit subscribe.